This relatively hidden area in Pretoria is inhabited by many people grappling with drug dependency. Here, they sometimes share needles to inject heroin-laden narcotics. Among them is Pumulani Malangu.
I don't have an excuse to say that I struggled in life or anger or stress. I don't want to lie. I was overspoiled growing up. As we speak, I have 3 kids. The mother to my firstborn is the one who knew I was an addict. She tried to be patient and had faith in me. I ended up stealing money from her bank account.
A team of health workers set up a needle exchange program with support from the University of Pretoria and the local government to help the drug users, and began visiting every week to give out sterile needles.
With the needles and syringes, because it's not a treatment, it can be viewed as you are enabling somebody to use. But it's the same argument we can have with condoms. When we distribute condoms, are we saying we're encouraging people to have sex? No. We are seeing the risk of having unprotected sex and therefore coming up with a way of saying, let's reduce the harm.
This initiative comes at a critical time, as South Africa has the highest number of people living with HIV globally, according to UNAIDS. But some non-profits partnering with the program have had to close, including at least one health clinic, due to the recent cuts at the US Agency for International Development. This is as the program also offers treatment for illnesses like HIV.
The staff are really helpful to us. For instance, I'm HIV positive and they assist me with medication. We get pills as well as needles and syringes, so we don't transfer illnesses to one another.
The team in Pretoria includes doctors and social workers who have built relationships with the drug users, encouraging them to accept an opioid substitution therapy.
We do see clients who are genuinely in a place where they really are tired. They really want to stop, they want to get out, they just don't know how. And a lot of the times you find that these are people who have tried to stop by themselves, they've tried to go to rehab, but along the way relapse. And because of lack of support and intervention, they're just back at square one.
The recent USAID cutbacks have negatively impacted these types of harm reduction efforts worldwide. Patients here are now forced to turn to crowded, poorly funded government-run facilities for any hope of treatment. Crystal Onkel, CGTN.